Tsitsi Masusu, and I work with youth advocates as their advocacy and communications officer. So Youth Advocates is a youth-led and a youth-serving organization. At the heart of what we do within the HIV response is to make sure that we provide services to our young people. So our target mainly focuses on adolescents and young people. But within working with adolescents and young people, we are working with people who do not live in isolation. So that means at the end of the day, in order for our interventions to be impactful, we also now need to bring in their families and the community as a whole.
Youth Advocates is a partner with National AIDS Council. National AIDS Council was very instrumental when we started as a school club in 2004. We were born out of the need to respond to high incidence amongst young people around year 2003-2004, and we mobilized young people from schools to come together to be agents of change in turning the tide in the fight against HIV. We came together, and National AIDS Council was there to provide the technical support and also the maybe the motivation that we need as young people. And we were very excited, and we are also excited today to see the progress that we've made as an organization.
Working under the helpline, I can say that I've seen that the helpline is one of the best model towards combating the spread of new HIV incidences and infection. So what we do as the youth helpline is that we receive calls from young people, adolescent girls and young women and boys who will be seeking SRH, sexual reproductive health related services. So what we then do, we refer them for service uptake. So to make sure that young people have received the services, we track the service provider and we track the client as means of confirming.
So in terms of working with adolescents and young people, we realized that in order to be able to have access to the Youth 393 Youth Helpline platforms, which are, we have the WhatsApp, we have got calls, we also have bulk SMSs. So the reason why we've got these different platforms is, one, we are also trying to look at issues of the digital divide. So you realize that in terms of the telecommunications in Zimbabwe, at least one person in every household has a phone, which might not necessarily be a smartphone. So the bulk SMS then tends to give information to those who might have like a phone but not a smartphone. And then the WhatsApp platform also serves to actually cater for the young audience, because you realize that most of our young people right now are on social media, and WhatsApp then provides a cost-effective platform for young people to be able to interact, at the same time get information.
Currently, we've grown from a school association to a national youth-led organization with functions or operations across the whole country and in all our implementation sites across the country. National AIDS Council helps us in terms of offering the space where we operate from, and also supporting us to identify the right young people that we work with within the communities. We owe our success to the support and also the mandate that National AIDS Council helps us to also be able to achieve our goals as an organization.
So today I would like to share with you 3 recent cases which we have managed at the call center. The one of a young lady who was victimized due to early marriages. She was married at 14. Then in that marriage, she was infected of HIV. Unknowingly, she became pregnant and she bore a child, and after some time the child passed on. So when we met her, it was during a community activation. So on one-on-one interaction, she then opened up that she once had a baby and she passed on, and she doesn't know what to do with her health as she was deteriorating every day. So we then referred her for HIV service uptake, that is testing services, where she was confirmed positive and she was initiated on ART. After initiating on ART, we were also tracking, giving support on adherence and how adherence can actually lead her to be a better person in terms of health. So she was being supported up until a viral load was on target, not detected. So as I'm speaking currently, she got remarried. She's now 18 and she had a baby, which is less than 6 months old, and the baby is actually negative. So this is one of the cases where we are seeing the impact and the value of the youth helpline, that it can reach young people, assist them to making better health decisions that are good for their health outcomes and their lives and the lives of their dependents as well.
So I would say that the 393 Youth Helpline is actually a game changer in how we're trying to digitalize access to healthcare. And this actually provides us with real-time data of what is happening within also our health facilities, making sure that this is a client-centered approach, because what we want to do is to ensure that the client gets the service that they desire at the time that they want to.
Our program has won different awards within the region and globally. We've won the MTV Staying Alive Foundation Award for extraordinary efforts in HIV prevention. We are the first and the only organization that won this grant in Zimbabwe. We've also won the UNESCO Youth Forum Label Award for exceptional community contribution. Worldwide, there are 9 organizations that were awarded, and within Southern Africa, we won this grant. And it's not just a testament of the exceptional work that young people working with youth advocates do in Zimbabwe, but a testament of how we work with National AIDS Council, the government of Zimbabwe. And also we are very excited that currently we are working in 3 Southern African countries, which include Botswana, Malawi, and Zimbabwe. And this is because of the support that we get to National AIDS Council. And as youth advocates, as young people who are growing, we will not be young forever, but our contribution to the HIV response is what will be the legacy in our youth generation. And we want to live a generation where young people will realize that HIV is history in the making, and we want to be part of that legacy. We want HIV to be history, and we are the young people who can make that change. As we grow, we want to be part of this history.